Dear colleagues, today we will be performing a filler application on a patient's face using the 30 and 20 milligram cross-linked hyaluronic acid fillers from the esteemed biotech company's Glodem product range. Today we have the pleasure of working with Ms. Ebru, who is 44 years old and has graciously agreed to be our model. I would like to begin by thoroughly evaluating her facial features in general prior to the procedure. When I conduct a classic facial assessment on our patient, the first thing I pay attention to is the patient's facial expression and overall demeanor. I strive to notice the impression her face conveys to me at first glance and the emotions she evokes in me, as this will guide our approach for the treatment. I try to pay attention to what the patient's face is telling me. Is there a tired expression? Is there an aggressive look? The smile lines add a positive expression to her when she is happy, or there is sagging on the skin. So that expression is a guiding factor in many problems that the patient's skin health and appearance. In this sense, looking at the expression is a very important criterion for us. Therefore, what we try to do is to ensure that the face has a positive expression when viewed from the outside. When I evaluated the patient's face, I noticed that she did not have a very aggressive, angry look. Her expression was looking tired, especially in relation to her under eye areas. In addition, we see that the sagging occurring in the pre-jaw area contributes to the tired expression. The oval shape of the patient's face was also considered. When we observe a face characterized by a slightly narrowed oval shape, which has an elliptical appearance extending from the top to the bottom, it tends to enhance and positively contribute to the overall expression of a woman. Therefore, we see that the elliptical expression on our patient's face is quite beautiful, and its ovality is very good. In addition to this, we can see that the patient may have a more squared face, which could be due to the patient's genetic facial shape, or it could be related to the hypertrophy of the masseter or temporal muscles, leading to an uncontrolled expansion of the face and a distortion of the facial oval. Some faces appear to expand downward in an inverted triangle shape rather than a connected triangle shape. This is crucial for prioritizing our treatment approach. The patient's skin quality appears to be good. Another topic I researched in depth is the patient's face proportions and their various projections. When we say proportions, we mean the distance between the hairline, glabella, septum, and septum, which is about 4 or 3 fingered. We can see that the patient is not in a bad condition. When we turn the patient to the side to see the projection, we can see that the patient's curve in the forehead, glabellar angle, nasofrontal angle, nose tip, lips, and chin are proportional with each other. We can see that the patient's needs. We need to consider the concepts of taking the patient's chin forward a little bit, or enlarging the upper or lower lip a little bit more, or raising the tip of the nose a little bit more, or making a bulge on the forehead, or taking the forehead projection forward to get a more attractive female look. We examine facial symmetry and asymmetry. You need to evaluate details such as whether one side is lower and the other is higher, depending on the lying position, whether the masseter is more hypertrophic on the right or left side due to a unilateral teeth grinding problem, and whether the brow line and the height of the eyebrow differ from one side to the other. The patient's dynamic and static facial lines are thoroughly discussed in this assessment. When the patient furrows their brows in deep concentration, raises their eyebrows in surprise, and smiles widely with genuine joy, these distinct lines that emerge represent our dynamic facial expressions quite well. If we observe that the patient also has prominent dynamic lines, we can consider incorporating a toxin treatment into our comprehensive therapy plan. However, if we notice certain lines persisting even when the patient is asleep and not making any facial expressions, and we are confident of the existence of these lines without any dynamic movement, we need to keep in mind that we should perform a filler treatment to effectively address the tissue loss within those lines. Alternatively, we might carry out a cannula-assisted subcision procedure to release any tissue adhesions that may be present. Additionally, we must assess the quality of the patient's skin. When you perform this specific hand movement, it is crucial to thoroughly evaluate the skin's elasticity to accurately gauge its overall firmness. This evaluation is incredibly important. If you observe a very loose and excessively crumpled skin texture resembling parchment when you perform this movement, it indicates that you cannot work extensively with products that have a high G value and excessive hardness, as they may not yield desirable results. Using these products may lead to localized hardness on the patient's skin, resembling granulation or nodular tissue, which can affect the procedures performed. The patient has been enduring this for some time and may struggle to cope. For high G values in thin skin, it is more advisable to initially perform treatments aimed at skin quality using softer products or a biostimulant rather than using lifting products. After that, you can proceed with lifting or volumizing procedures on the patient's face. Finally, we carefully assess the lip and nose areas on the patient's face, which I consider as distinct independent regions that stand alone. We can enhance a patient's facial appearance by applying targeted treatments to specific areas of the face. The nose is the most prominent point on the face, and small procedures in this area, such as narrowing, enhancing the tip of the nose, or making the nostrils appear slightly narrower through filler applications, can greatly improve the patient's facial aesthetics. Additionally, lifting the lip structure to create a more smiling effect, or shortening the distance between the lip and nose, as well as slightly turning the lower lip downwards, can contribute positively to the patient's appearance. Not every patient who visits your clinic may have the financial budget to afford all these procedures, nor might they be willing to accept all of them. In this situation, your task is to optimize the patient's requests with the number of syringes you have at hand and to determine which application will provide the greatest benefit to the patient when prioritized. To effectively optimize the process, it is essential to consider the patient's specific wishes, your personal preferences and capabilities, and also the total number of syringes available or the budget that the patient has allocated for this particular task. These details are crucial for successful outcomes. For example, when the patient has a limited budget for fillers in their hand, you should not attempt procedures that aim to lift the entire face or restore volume in a face where volume loss is the main concern. These types of applications lead to a result that will make the patient unhappy without making any difference. In that case, nose filling, lip filling, filling under the eye or forehead wrinkles that you can fix with just a syringe. If you want to evaluate a middle face, you must discuss with your patient from the beginning that you will definitely need 3 syringes and what you require. To enhance the appearance of a more pronounced jawline, it is essential to clearly explain to your patient during the initial consultation that achieving their desired results may require the use of 4, 6, or even 8 syringes in that area. Additionally, to effectively fill a temple hollow, you might need anywhere from 1 to 3 syringes, depending on the individual's unique anatomy. This detailed explanation helps ensure that the procedures you perform lead to optimal results and patient satisfaction. Upon taking a closer look at the patient's face, it becomes evident that in this particular area, the effects of gravity have caused the fat tissue, along with some muscle tissue, to begin sagging forward. This noticeable sagging underscores the significant impact that gravity has on the structural integrity and appearance of the facial region over time. The area behind this publication is our static area, our area that is not active in any way. However, the area in front of it, the area in front of the ligaments, let's smile with facial movements, regions most impacted in patients of this specific type. If you perform applications in dynamic areas on individuals with adequate subcutaneous fat tissue, you will likely cause noticeable and significant changes in the patient's facial expression and overall appearance. This can sometimes lead to a positive change, but more often it results in a negative change. Therefore, in patients, especially in this type of case, where you believe that the subcutaneous fat is good, but has dropped somewhat due to gravity, the procedures you perform should be as lateral as possible, that is, from the static area. The procedures should enable the patient's own fat tissue to be elevated back to its original position. You should not forget that the procedures performed from the temple area, that is from above and laterally, provide a natural lifting of the face in exactly the way the patient desires, without creating a significant change when viewed from the front. You will encounter patients where volume loss, bone resorption, and loss of subcutaneous fat are prominent. In such cases, yes, replacing what is missing in dynamic areas with appropriate filler materials will provide a substantial advantage in performance and stability. It is extremely crucial for the patient to receive positive reactions and feedback in social settings outside of their usual environment. The structures here emphasize sagging in the preaxial region and the temple area. Notice how, starting from the forehead, the hand drops into a pit before rising again with the zygoma. This means that we can realize the importance of filling the hollows in the temple area to support this region, contribute to ovality, and provide a lifting effect to the face and gaze. The patient benefits from a wide and prominent forehead. Enhancing support in this area, along with the surrounding fat tissue, will significantly benefit the overall positioning of the eyebrow. In patients of this type, when applying toxins, you should not forget that elevating the eyebrow can lead to puckering in this area. The subcutaneous fat tissue has dissolved. Therefore, when you apply the toxin at this point in these types of patients, the eyebrow will droop down to avoid creating a pleat, but this time the patient won't be able to achieve the fresh look they wanted. To effectively support these key points, it's essential to remember that incorporating filler materials will significantly enhance the overall argument's impact. We assess the face. We believe that supporting the mandibular angle while excluding the middle part of the jawline will positively contribute to this area by enhancing the prejowl and the posterior mandibular angle. I truly believe that after gently lifting the midface laterally, we can significantly enhance the overall appearance of the area just in front of this under eye bag by providing additional support with a carefully administered hyaluronic acid filler. Actually, she's not really an ideal candidate for under eye filler. The subcutaneous structure is notably loose. A patient approaching surgical limits, but if the patient is not considering surgery, any supportive treatment you provide in this stage will make them extremely happy. Filling the piriform fossa adequately is essential for achieving an improved alignment and overall aesthetic position of the midface in this particular patient. Finally, when we evaluate the area around the mouth, I believe that filling the mentolabial region, particularly due to the increased activity of the depressor anguli oris muscle, will help support the drooping at the corners of the mouth. This approach may provide advantages by allowing the chin to drop slightly lower, thereby reducing the activity of the mentalis muscle. If possible, it would be a sensible approach to perform a mental block with toxin beforehand and then evaluate this area of the patient approximately 15 days later. Raising the lateral parts and the middle of the upper lip slightly creates a protrusion in this area, which we refer to as a baby-like lip structure. Therefore, let's gently open our mouths a bit wider. We firmly believe that providing support to this specific area and this particular part of the oral structure will significantly enhance the overall appearance and function, leading to a more appealing and confident smile for this patient. We will persist in this course of action. A slight thinning at the tip of the nose may provide an advantage for this patient. If you want, let's start your applications.